Hi, I'm Robin Shooter, founder of Empower Total Health, and this week's weekly update is about hormonal contraception and women's mental health. A massive Danish study has sounded alarm bells about the effect of hormonal contraceptives, both oral contraceptive pills and also patches, vaginal rings, and hormone-releasing IUDs, on women's risk of developing depression. But no one seems to be listening to those alarm bells. Researchers from the University of Copenhagen utilised Denmark's excellent centralised medical record-keeping system to track over 1 million women who were aged between 15 and 34 at the beginning of the study, over a 14-year period between January 2000 and December 2013. And the use of hormonal contraceptives was compared to their risk of subsequently being prescribed antidepressants or being diagnosed with depression at a psychiatric hospital. Their findings were concerning, to say the least. Compared with women who weren't using any form of hormonal contraception, the risk of being prescribed antidepressants for the first time, that is, going on contraception and then subsequently being prescribed antidepressants, was 23% higher for women taking the combined oral contraceptive pill. In Australia, that's brands like Microgynon, Levlon, Noramine, Yasmin, Diane, Trifasal. It was 34% higher for women taking the progestogen-only pill, otherwise known as the mini pill, like Microval, Microlute, or Micronor. It was 100% higher, that is double the risk, for women using a contraceptive patch like Ortho-Evra. 60% higher in women using a vaginal ring, such as NuvaRing. 40% higher in women using a levonorgestrel uterine system, such as a Mirena, and 90% higher in women using a medroxyprogesterone acetate depot like Depo-Provera or Depo-Relavira. Even more concerning, adolescents aged 15 to 19 who were prescribed hormonal contraception were even more susceptible to becoming depressed than older women. The risk of being prescribed antidepressants for the first time was 1.8-fold higher in teens taking the combined oral contraceptive pill, 2.2-fold higher in teens taking the progestin-only mini pill, and 3-fold higher in teens using non-oral hormonal contraceptives like the rings and patches. When it came to the risk of being diagnosed with depression at a psychiatric hospital, the numbers followed a similar pattern in both adult women and adolescents. As if these numbers weren't bad enough, the researchers pointed out that they are most likely underestimates of the true risk of developing depression as a consequence of using hormonal contraception because of what's called the healthy user bias. In other words, women who notice a deterioration in their mood and consequently stop taking their pills or using their devices don't end up in the doctor's office complaining of depression, and hence they're not prescribed antidepressants. In fact, when the researchers compared the risk of depression in women who are currently using hormonal contraception to those who had never used it at any time in the past, the risk estimate was actually 38% higher than when they compared current users to women who weren't using it at the time but may have in the past. In other words, there was a higher risk of becoming depressed in women who had ever used hormonal contraception. As the authors point out, previous research has shown that women are about twice as likely to be diagnosed with depression at some point in their lives than men, but only after puberty. In fact, some studies have found that prepubertal girls are actually less likely to be depressed than boys. Women's greater proneness to depression has been attributed by some researchers to the effects of women's fluctuating sex hormone levels on various regions of the brain that are involved in emotional and cognitive processing. But the synthetic progestins that are found in all hormonal contraceptives have a more pronounced effect on neurotransmitters involved in mood than the body's own progesterone. In my practice, I've seen several women who've become suicidally depressed while using hormonal contraception, particularly implants, which release these progestins, synthetic progesterone, into the bloodstream over the course of several months. And many of my clients have shared really quite heart-rending stories of the impact of their black moods on their relationships with partners, children, and even on their careers. Now, if you were to take a totally cynical view of this, you might argue that putting a teenage girl on hormonal contraceptives is the perfect way to generate a lifelong customer. According to the Danish study, within 6 months, this girl is likely to be back in the doctor's office complaining of depression. A prescription for antidepressants, most commonly an SSRI like Cipramil or Lexapro or Zoloft, is just about guaranteed. These drugs have been found to worsen the course of depression, causing depression to become chronic and increasing the risk of relapse if she stops taking the drug. Now, rather than recognizing this relapse as being drug-induced, her doctor will most likely conclude that she needs to stay on the antidepressant indefinitely. In addition, taking that SSRI antidepressant may increase her risk of developing a new set of symptoms that might earn her a diagnosis of bipolar. Another prescription for yet more drugs. If she stays on that SSRI, she'll end up with a 70% higher risk of suffering osteoporotic bone fracture, and that will result in a prescription for bisphosphonate drugs or infusions like Fosamax or Actonel or Aclasta. Furthermore, if she takes her SSRI throughout pregnancy, her baby has almost double the risk of developmental delay and autistic spectrum disorders in infancy, which lead to cognitive difficulties in childhood. And her child also has a 40% higher risk of speech and language disorders. And all of these raise the risk of the child earning his or her own crop of diagnoses, which result in the child becoming a lifelong customer of the medical industrial complex too. Not that I'm a cynic. There has been very little media coverage of this incredibly important Danish study since it was published late last year. And I am yet to encounter a client whose GP or gynecologist has actually discussed the study with them, despite over half of my female clients being on antidepressants when they first see me, and the majority using some form of hormonal contraception. GPs and other doctors seem shockingly willing to prescribe hormonal contraceptives to both adult women and teenage girls without any informed consent process whatsoever. The risks and benefits are never discussed in a balanced way. Instead, if a patient who is impertinent enough to ask if hormonal contraceptives carry risk will usually be just batted off with this reassurance that pregnancy is actually far riskier than being on the pill. That's not the point. The point is that women are only capable of becoming pregnant for less than a week out of every month, whereas men are constantly fertile. I mean, you look at them and they're making sperm. Yet in most relationships, women bear the sole burden of responsibility for contraception. And sometimes this occurs at great cost to their physical and or their mental health. Years ago, I read a book by the late, great Dr. Robert Mendelsohn, and it was called Male Practice, How Doctors Manipulate Women. And it was absolutely excoriating of the medical profession. Mendelsohn argued that institutionalized sexism in modern medicine resulted in far more unnecessary, degrading, and dangerous practices being inflicted on women than on men. Unfortunately, even most female doctors are socialized by their medical education into exposing girls and women to the considerable risks of hormonal contraception without a second thought, let alone a proper informed consent process. I remember my own experience as a 19-year-old with a very delightful doctor who was an excellent listener and very caring toward her patients, but who very cavalierly just put me on the pill when my periods were a bit irregular. No informed consent process whatsoever. Now, the only defense against this institutionalized sexism is for women to start thinking and talking about contraception as a feminist issue, to demand that their partners take equal responsibility for the prevention of unwanted pregnancy, and to get themselves informed about the risks of hormonal contraception and the alternatives to it. My Empower Ed program provides you with the knowledge, the skills, and the tools that you need to become an informed consumer of health and medical services. I really encourage you to sign up for your free 1-month trial of Empower Ed membership today. There's a link at the end of this video and in the notes just below the video. And of course, if you want some one-to-one input on your current medication and how it might be affecting your health and what your options are, you can always come and see me for a one-to-one appointment. And that's also available online. So I hope you found this topic valuable. Please do like the video, share it with the women in your life, the girls and women. Let's get a conversation going about the impact of hormonal contraception on women's health. And I will catch up with you for next week's weekly update.